Hi. Almost two-thirds of Aboriginal and Torres Strait Islander Australians live in inner regional, outer regional, remote or very remote areas. And these populations already have poorer health outcomes than people living in metropolitan areas, just due to their location. The National Aboriginal and Torres Strait Islander Health Plan for the decade recognises that care for Aboriginal and Torres Strait Islander people needs to be place-based and centred on the person. Health services and organisations need to respond to the different experiences across urban, regional and remote locations. The plan includes a focus on important environmental aspects such as housing, food and water security, and risk factors such as alcohol, tobacco and other drugs, which can be heightened in rural and remote areas. Aboriginal and Torres Strait Islander people living in remote areas usually access primary health care from a GP who is part of an Aboriginal Medical Service or a community clinic. And that's why the health plan has a focus on extending the reach of community-controlled health services into areas of unmet need. This includes a focus on sustained capacity building to improve culturally safe service coverage and access to care on country. It also requires the continued expansion of point-of-care testing, telehealth and other digital technologies. The plan recognises that a place-based approach is also critical for culturally safe responses in times of challenge, such as what we've seen during the COVID-19 pandemic. Finally, the plan seeks to grow the Aboriginal and Torres Strait Islander health workforce in rural, regional and remote areas. As the Minister for Regional Health, I welcome the plan's vision for Aboriginal and Torres Strait Islander Australians living outside the cities.